Under an hour, President Obama becomes part traveling salesman, part explainer-in-chief, pitching health care and laying out exactly what he believes consumers can expect when they start to sign up for the marketplace exchanges next Tuesday. But will this latest push help the president attract people to his plan? Because that's really what this is about. Let's bring back our gaggle, Doug Thornell, Mattie Duppler, and Ann Kornblut. Mattie, you coming from the conservative side, a lot of Democrats are sitting here and saying, you know, this criticism from conservatives is simply because they're afraid it's going to work.
Well, also the criticism is coming from people who are in charge of implementing this law. You've heard from many states with Democrats at the helm that their exchanges aren't ready. And we still don't know what the federal exchange looks like. You know, all signs point to the fact that this law is not ready. So if you are someone who actually believes that Obamacare is going to benefit the nation, you should probably be uncomfortable, too, with the idea that this is going online on Tuesday.
Doug, let's say you have 1,990,000 successful transactions. You have 10,000 unsuccessful transactions. We're going to hear a lot about those 10,000 unsuccessful transactions, probably more so. How does your side combat this issue?
Well, that's kind of been the
Let's say you have 1% of problems that are going to get blown up.
Well, but that's been the story of the whole healthcare debate.
If it is
the last 3 years, right? We don't hear a lot about the 15 million young kids who have insurance under their parents' plan. We don't hear about the small businesses who have tax credits. We don't hear about the kids who have pre-existing conditions who have health care now. We don't hear a lot about that because a lot of it's focused on the process. And, you know, I'll readily admit that Democrats, you know, we fell down because we got the focus of the health care debate became the sausage-making process. Now what the president needs to do is focus on the individual components of the plan that have been popular throughout. And I think he's also going to point to a lot of the people who are going to get coverage after October 1st, beginning in January, as examples of this plan working. And the reality is the Republicans have not presented an alternative plan. Their alternative is basically get rid of Obamacare, voucherize Medicare, and let 35, 40 million people go without care.
Well, the Conservative Caucus actually just introduced a bill as an alternative
But I think, don't you think that is a little late, though? That has been a big problem, don't you think?
That is late, but, I mean, again, the Paul Ryan plan was the alternative plan that we've been talking about for 4 years.
You and I, not to show our age a little bit here, but you and I remember the Medicare Part D. And I remember at this point in time, literally days before it was rolled out, disaster was predicted. I mean, it was one of David Seamus's point earlier this morning, and I do remember that. There were just a lot of predictions of doom and gloom, and then I walked into my CVS, and it seemed like they were handing out brochures, and everything was going swimming.
And after a little while, after all the kinks got worked out, it started to work, paying for it a different matter. But I have to say, I think what the White House is banking on, to your point about the 10,000 who don't get it, is people hearing stories of people, other people they know. And this kind of grassroots effort has worked for them in the past. If anyone can pull that off, it's them. And so they can't wait for it to just start working. Maybe not October so much as January, when it really starts to take effect and people can talk about it and share their good stories.
Oh, all right. I have to go to shameless plugs. Mattie?
Causeofaction.org. It is a nonpartisan journalist watchdog. They're doing some good stuff on Virginia race, so check them out.
We will take a look.
Maryland Attorney General Doug Gansler announced his campaign for governor this week. He's on a 17-stop tour.
So I take it you have a preference in this primary?
Yeah, you'd say that.
All right, I won't talk to the lieutenant governor then, huh? And Ms. Kornblut.
And the Washington Post today, we have a look at 8 different people and how they will be affected by the health care law.
A very good way to do it. We got a big health care week coming up at all the NBC News platforms starting next week. That's it for this edition of the Daily.